We're here today to talk about a rather unusual form of breast cancer, inflammatory breast cancer. In chapter 11, we talk all about inflammatory cancer and all the major ramifications, as well as some of the good news about inflammatory breast cancer. But one of the nicknames that physicians use when they describe inflammatory breast cancer is a silent killer. And the reason they say that is often in these cases, the cancer is so advanced and it advances so quickly, it grows so rapidly, that by the time the patient sees the doctor, or particularly the oncologist, this thing has spread and it's no longer curable. So one of the things I wanted to do in showing how the book actually works in real life is get examples of somebody who's been through inflammatory breast cancer, and not only has just made it through the first few years, but somebody who is now almost a 15-year survivor. So Leslie has agreed to come in and talk about her story, and she has one particular form of inflammatory cancer that seemed particularly aggressive, and but you can see she's here today to talk with us.
Yes,
so tell us, Leslie, how did this start, or what did you first notice?
In 2002, I noticed that my left breast was inflamed, and I actually weighed it. It was heavier. I had a Weight Watchers scale. And
I've never heard of anybody weighing their breast. This is a first. We may have to start a new chapter. For the next book, we're going to put that.
And so I went to my gynecologist because I had no idea what was going on. And thankfully, she recognized that it was not something that...
Not an infection or something.
Not an infection. She recognized that it could be related to breast cancer. Mm-hmm. And I was able to get into Dr. John Link's office within 2 days.
Well, you picked the right oncologist because there's nobody better than Dr. Link. He really knows this stuff. And he was at the cutting edge in this particular type of cancer.
From above, I was getting guidance.
Right. So this is somewhat of an unusual presentation that almost apparently overnight your breast turned red. How would you describe it?
Yes, I didn't really notice it. I would say it took me a week to get into my gynecologist after I noticed it.
What did you notice first?
Just the size of it was growing, and the color was turning red.
So in essence, one day or 1 week, as far as you were concerned, everything was normal? And
yes.
It seemed like a matter of a few days?
I'd say.
No, I'm sure you're right. I have seen this before, but that's the most aggressive form of inflammatory that we see.
Yes.
And so oftentimes it starts out as a smaller red spot, maybe a little skin thickening. But,
yeah, it seemed to be the entire breast.
Yeah. So we don't really know what was going on before that. Presumably there's a tumor in there growing. It turned out to be an aggressive form of tumor that creates this redness, which is a sign of a more aggressive tumor, and probably was in the lymph nodes at that time and blocking things up and made the breast swell, kind of lymphedema of the breast, if you will.
Yes, but my understanding was that you can't really call it a tumor because there's not a lump. It's not a lump. Right. Maybe a tumor, I guess, but there's no lump.
Yeah, that's the great point. In both with the lobular cancers, which we call the devil's cancers, but they're much slower growing, but they can produce sort of the same thing.
Yeah.
But the difference is that inflammatories present oftentimes is just redness, swelling of the breast, heaviness, although I've never heard anybody weigh their breast.
I had a circular bowl scale from Weight Watchers. And
so that's very interesting. But the whole breast can grow and become heavy and distorted. Typically not quite so quickly. But I've seen other cases that are just like that, and I remember a 28-year-old girl that I talk about in the book, who within a month it went from a relatively small area of redness to the whole breast was red and swollen, and she had an advanced cancer and did not do as well as you did. It was before you, and we didn't have as good a treatment at that point in time. So let's move forward then. So you're lucky enough to find a world's authority on inflammatory breast cancer.
Yeah. And so he set up a court. Well, first he did a biopsy, and it was over a holiday that I was visiting other people, and I got the news when I got home, and I just felt so good about Dr. Link that it didn't worry me. I knew I was in the best hands.
Yes. It's a good feeling.
It is. And so they had myself and my husband in right away and set up a course of action that included 9 chemos, 9 chemo infusions, 3 different types of chemo. And I never experienced nausea. He had me set up so that he prevented all of the bad side effects other than the normal, you know.
The loss of hair.
Yeah.
But it did
Yeah.
come back.
Yeah, and my husband convinced me to leave it white
Okay. Well,
because
you look great.
I always dyed it really dark.
So the chemo, you just kind of sailed to it. What happened to the breast? What was your observation in terms of?
I think almost immediately it reduced in size, and so you know I knew that the chemo was activating.
That's a great feeling, isn't it? To visualize that shrinkage.
But I really just knew he was taking care of me, and I did try a inflammatory breast group, you know, support group, but it wasn't for me.
There's a lot of, what was it about the support group? Because I've had some observations that there's been some problem with some of the support groups.
Well, I hate to say this, but we were losing people.
Yeah, well, that would, yeah.
And I just didn't want to think about it.
Yeah.
Because I knew I was in good hands.
Yeah.
And I really didn't want to observe that people that I might have gotten close to were in much worse case. So.
Well, we are getting better results now, so that's one of the good news. So the question comes up, and one of the problems here is so many different ways that inflammatory breast cancer can present. In most cases, you're seen by your primary care doctor, as you were, and they're not quite as smart as your doctor was possibly, or it wasn't quite as crystal clear that there was a major problem, because oftentimes they look like just an early onset infection, and infections are 100 times more common than inflammatory breast cancer.
Right.
And I've heard it said that the patients come into me with a minimal, what looks like a bug bite, and they're worried they have inflammatory breast cancer. So once the word got out about inflammatory breast cancer, there was an initial kind of almost a hysteria that every little area of inflammation. So what I tell the patient, we talk about in the book, if you have what looks like a bug bite with a little inflammation, just give it a few days. If the bug bite is going to go away completely. But if something persists or certainly increases or is associated with a lump or heaviness of the breast or some level of distortion, you need to assume that it could be an inflammatory breast cancer. And what I have done in any way when it comes in with an area of inflammation is start them usually on antibiotics, unless it's an obvious case like yours. We go directly to the biopsy. If they're not better in 1 week, we'll do an internal biopsy. The problem is a lot of them don't have a lump. And it's hard to aim the biopsy, know exactly where to go.
Yeah, I'm not sure the magic that took place when they really were able to hit the right spot, because they diagnosed it with that. A couple of the
helpful things there with the ultrasound, we'll sometimes see a little distortion, maybe not an actual lump. We often will see an enlarged lymph node that gives us an indication that something is going on. But the thing is to be aggressive and not just say it's an infection or a recurrent infection. The big message, I think, is when patients come to me and they've been on 2 or 3 courses of antibiotics and nobody's kind of figured it out and it's getting worse. Those patients are so disturbing. And that's one of the things in the book. We want to empower women to say, well, doctor, I know it was an early infection, but it's not responding. I'm concerned that maybe I have inflammatory breast cancer. Then those women probably need to see a breast specialist.
Oh, yeah.
And read the chapter, because it tells you step by step, the pitfalls that might happen. So I think the other thing that patients need to know is that, first of all, this inflammatory is rare enough that most of the time when you have redness or what looks like an infection, it's going to be an infection. Some infections are a little bit more challenging. They may take a time or two to settle down, but if you do have an infection that doesn't respond to initial treatment, or redness that doesn't clear immediately or within a few days with antibiotics, then you think that you need to see a breast specialist and consider the diagnosis of inflammatory breast cancer.